Good afternoon,
Good afternoon.
and welcome to the 16th, if you can believe that, the 16th regularly scheduled meeting of the ETSU Board of Trustees. As President Nolan has said many times, graduation begins today on the campus of ETSU. Each day, our students move one step closer to the day in which they will achieve the dream of earning a college degree. Each day, our faculty and staff are part of those journeys as they assist, support, and empower those students in their persistence toward graduation. For the class of 2020, that final day arrives in just 4 weeks. ETSU will confer degrees to our newest graduates on Saturday, December the 12th. As it was this past spring, graduation must be a virtual event and will include ceremonies for each college. The dean of each college will provide congratulatory remarks along with many of the faculty and staff members that the students have known throughout their time at ETSU. I join with my fellow members of the Board of Trustees in congratulating class of 2020 for achieving this milestone moment. And we extend best wishes for the journeys that are ahead for each of them. Let's give our graduates to be a virtual round of applause. As you know, we continue to face the effects of COVID-19. ETSU Health continues to step forward in its fight against the spread of the virus. A few weeks ago, ETSU Health launched a COVID-19 collection site that delivers testing results to patients within 24 hours. The tests are available to both symptomatic and asymptomatic patients, and the results are processed in-house. Tests are performed at the Johnson City Community Health Center, and appointments can be made online. Throughout the pandemic, ETSU Health has been a regional leader in offering testing and providing education on COVID-19. I want to thank Doctors Bill Block, Sherry Holmes, Jonathan Mormon, Lee Johnson, Randy Wyckoff, and the many providers, staff, resident physicians, and students who are part of ETSU Health for their service on our front lines. Other important achievements from the university since our last meeting include, and this is appropriately timed, our new esports varsity team competed in the game Overwatch and finished its inaugural season 8-1. And earned a spot in the Overwatch Fall Cup playoffs. The team finished in the top 16, and we extend our congratulations to Coach Jeffrey Shell and the students who are part of that team. Our other esports varsity teams will begin competing in the League of Legends game beginning in January of 2021. Last month, ETSU dedicated the Dr. Patricia Robertson Pride Center, which is located in the D.P. Culp Student Center. Dr. Robertson is a retired faculty member who was a champion for inclusion, equity, and diversity on this campus and across our region. The U.S. Department of Education awarded a $2.5 million grant to faculty in the Clemmer College to support the Access ETSU program.
That's great.
This program began last fall and is a 2-year non-degree program for for individuals with intellectual disabilities.
That's great.
Participants attend classes, enroll in internships, and have access to the same activities and services as other ETSU students. With this grant, tuition assistance can be provided to students who enroll, and the university can hire additional staff to support the growth of this program. In addition, the National Institutes of Health awarded a faculty member at the Quillen College of Medicine, Dr. Cha Fu Lee, a $2.19 million grant to study cardiovascular dysfunction in sepsis. Dr. Lee is one of many brilliant scientists we have at ETSU.
Wow.
Whose research and other scholarly activities are greatly enhancing our knowledge about the ways diseases can be prevented and then treated. One department alone in the College of Medicine, the Department of Biomedical Sciences, has received over $7 million this year to support their research efforts. At this point, I now turn to Dr. Green and ask that he call the roll and run through the required questions, since once again, we're meeting via Zoom.
Thank you, Mr. Chairman. Chairman Niswonger, because trustees are participating remotely by Zoom, I must run through a series of questions before calling roll. Additionally, because we have trustees participating remotely, should any votes be taken, they must be taken by roll call. Trustees, in accordance with Tennessee Code 8-44-108, Section C3, I have 2 questions to ask if you could answer for the record. I will ask both questions once and follow with a roll call so that you may respond. First, are you able to clearly hear those on this virtual meeting so that you can participate? And can you please identify any persons present in the room with you from which you are participating in this meeting? Trustee Ayers.
I can clearly hear and no one is with me.
Trustee DiCarlo.
I can hear clearly and no one is with me.
Trustee Foley.
I can hear and no one is with me.
Trustee Grisham.
I can hear clearly. No one's with me.
Trustee Latimer.
I can hear clearly and no one is with me.
Trustee Austin Ramsey.
I can hear clearly and no one's with me.
Trustee Ron Ramsey.
I can hear clearly and no one's with me.
Trustee Stigall Jones.
I can hear clearly and no one is with me.
Trustee Wolf.
I can hear clearly and no one is with me either.
Chairman Niswonger.
I hear you clearly, no one is with me.
Chairman, I do not detect a physical quorum present. However, a quorum does exist by the inclusion of members participating by electronic means. In accordance with Tennessee Executive Order 65, permitting safe, open, and transparent public meetings by electronic means, I would offer up to the board the following reasons that necessitate this meeting. Business critical to the operations of the institution are slated for this meeting, such as the consideration of the modified spring 2021 academic calendar, October budget revisions, the Title IX rule, and updates on ETSU 125 Chapter 2 KPIs and ETSU's COVID-19 response. Due to the COVID-19 virus outbreak and subsequent recommendations from the Centers for Disease Control and Prevention, as well as Governor Bill Lee, social distancing measures and limit on group gatherings are being observed. For these reasons, I would contend that participation by a quorum of this board members by electronic or other means of communication is necessary. Chairman, I ask that a motion be made and a roll call vote be taken for the determination on the necessity of holding this meeting. An affirmative vote will signify that a necessity does exist for this meeting to proceed. A dissenting vote will signify that a necessity does not exist for this meeting to continue.
May I have such a motion, please?
So moved.
Second?
Second.
Thank you.
Trustee Ayers.
Aye.
Trustee DiCarlo.
Aye.
Trustee Foley.
Aye.
Trustee Grisham, Trustee Grisham,
Aye.
Trustee Latimer,
Aye.
Trustee Ron Ramsey,
Aye.
Trustee Segal Jones,
Aye.
Trustee Wolf,
Aye.
Chairman Niswonger.
Aye.
Mr. Chairman, you have a quorum and the need for this meeting has been voiced.
Thank you. It dawned on me when every single one of us are alone, we must be lonely people out here today. The next item of business is item 3, public comments. Because this meeting is being conducted virtually, we are unable to receive public comments in our traditional manner. However, for those of you who are watching, should you have comments that you would like to make or bring before the board, please email those comments to trustees@etsu.edu. Next item of business is approval of our September 18 minutes. Do I have a motion?
So move.
And a second, please.
Second.
Okay, Dr. Green.
Trustee Ayers,
Aye.
Trustee DeCarlo,
Aye.
Trustee Foley,
Aye.
Trustee Grisham,
Aye.
Trustee Latimer,
Aye.
Trustee Ron Ramsey,
Aye.
Trustee Segal Jones,
Aye.
Trustee Wolf, Trustee Wolf,
Aye.
and Chairman Niswonger.
Aye. Our first committee report will be on academic research and student success, chaired by Dr. Lattimore. Linda?
Good afternoon. Our committee had a really informative and interesting meeting this morning. We started off with an action item that Dr. Bishop presented, explaining the revised spring 2021 academic calendar due to the pandemic. Our committee approved the calendar unanimously in order to be on the consent agenda for the full board's consideration. Dr. Bishop then presented, along with Dean Sample, an information item regarding the letter of notification for the establishment of a master's in science in orthotics and prosthetics. Dean Samples explained that this important program will be one of only a handful in the entire nation. So we're really excited to see that program come to fruition. Next, Dr. Nolan gave an exciting presentation of the Research Foundation reorganization. Professors Golden and Dr. Duncan walked us through the amazing possibilities of this reorganization, and the board participated in a very active discussion. Part of the discussion included the impact of a private-public partnership, all of the endless opportunities if we just take the time, dream big. It'll really affect regionalism, and I think Dr. Nolan will be expanding more on this topic this afternoon. And then finally, Drs. Linville and Block gave us an update on the ETSU Ballot Coordinating Council. The board had some discussion as to the community's perception of an integration. Many think we already have a full academic health science center, but I think that we are just finally getting to this opportunity to make a change so that the public advantage that was written in the COPA will be seen for our entire region. That pretty much sums up our morning committee meeting. Thank you.
Dr. Lattimore. Our next report will be our audit committee, chaired by Trustees Segal Jones.
Good afternoon. It's always great news when the audit committee meeting is mundane. So I'm very pleased to report that our meeting this morning was mundane. With that said, we did have several items on our agenda this morning. We approved the audit committee charter and the charter of the internal audit department. That was unanimous. The audit committee charter will be included on your consent agenda. Ms. Lewis also reviewed with the committee our responsibility as members of the audit committee. She also then briefed us on audits and investigations that the department had completed between April 1st and October 31st. She also updated us on the current status of the internal recommendation log as of October 31st and her audit plan for the fiscal year 2021. It was clear that she and her department did not let the challenge of being in a remote environment keep them from getting much accomplished during that time, as she showed that there were no audit projects behind schedule. Finally, we improved the internal audit department's operating expense budget for the fiscal year 2021, and that was also a unanimous vote.
That it, Melissa?
That's it.
Okay, all right. Thank you. Last but not least, we'll hear from our Finance Administration Chairman, Steve DiCarlo.
Thank you, Mr. Chairman. Good afternoon, everybody, and a special thank you to Dr. King and Pam Ritter for walking us through our committee meeting this morning. The Finance and Administrative Committee met this morning to review several items. The committee approved the October 2020 budget revisions, which are included in the board consent agenda. The committee received a report on the unaudited financial statements. The audit is nearing completion and the exit conference will be scheduled soon. Reports will be mailed directly to trustees after completion of the edit process in the Tennessee Comptroller's Office. The committee reviewed the university's Composite Financial Index, the CFI, report, and the ratios demonstrate the continued financial health and stability of the university. The committee reviewed a report prepared in compliance with the Tuition Transparency Act. The report is provided to the state legislature each year to demonstrate how tuition revenues were used and the effect on student cost of attendance and financial aid. The committee reviewed the quarterly report of contracts and agreements over $250,000. The committee also received a report from the ETSU Foundation on the performance in fiscal year 20 and the activities ongoing in fiscal year 21. With that, we conclude our report.
Thank you, Steve. Next will be the consent agenda. As noted in the materials found behind tab 2 of your agenda materials, you'll find items that were discussed during this morning's committee meetings. Please note that the letter of notification regarding the establishment of a Master's of Science in Orthotics and Prosthetics have been removed from the consent agenda. The board previously approved the letter of notification, and today's item was for information only. Are there any other items on the consent agenda that members would like to pull for consideration by the full board? Hearing none, I would then ask for a motion and a second for the adoption of the consent agenda.
I move we adopt the consent agenda.
Second.
Thank you. Dr. Green.
Trustee Ayers,
Aye.
Trustee DiCarlo,
Aye.
Trustee Foley,
Aye.
Trustee Grisham,
Aye.
Trustee Latimer,
Aye.
Trustee Ron Ramsey,
Aye.
Trustee Stigall Jones,
Aye.
Trustee Wolf,
Aye.
and Chairman Niswonger.
Aye.
Unanimous.
Thank you. Next item, Title IX, Rural Bylaws. I'd now like to ask Dr. Mark Folks to deliver this agenda item. under tab, which is you can find under tab 3.
Okay, well, this is really just the second go around on this particular item. You may recall that we previously presented to you an emergency rule for approval. This was due to a change in the federal regulations that was new rules under Title IX were released back in May, and we were given an August 14th deadline to implement our new rules in accordance with those regulations. So we previously brought before you an emergency rule that was then filed with the Secretary of State back on August 14th. It became, so we met the deadline. Emergency rules are effective immediately upon filing. And so what you have before you now, the emergency rule is only good for 180 days. And that just gave us time to run the formal rulemaking process. So we have done that. This is exactly the same in all substantive respects. And I think even in non-substantive respects, we haven't changed anything, except this is not an emergency rule. It is the formal rule. So in essence, again, in short, we're just repeating the process because we need the formal rule to replace the emergency rule before the emergency rule runs out at the end of 180 days.
Okay, thank you. Next, we have discussion on the ETSU 125, what we're calling Chapter 2, Strategic Plan and KPI Update. Dr. Mike Hoff, please.
Mr. Chairman, members of the board.
Mr. Chair, Dr. Huff, if I could interrupt just for a second, and I apologize, but the last action on Title IX does require a board vote. And then also as a point of context, Dr. Folks and I will be in Nashville next week presenting our emergency rule to the General Assembly. But the prior agenda item found under tab 3 in your materials does require a board vote.
Thank you, Dr. Nolan. Do I have a motion? In a second.
Second.
Dr. Green.
Trustee Ayers.
Aye.
Trustee DiCarlo.
Aye.
Trustee Foley.
Aye.
Trustee Grisham.
Aye.
Trustee Latimer.
Aye.
Trustee Ron Ramsey.
Aye.
Trustee Stigall Jones.
Aye.
Trustee Wolf.
Aye.
And Chairman Niswonger.
Aye.
It's unanimous.
Thank you. Mike?
Thank you, Mr. Chairman, members of the board. If it's okay with you, I don't have anything to share. The president will highlight some of what I'll talk about in more detail in his presentation. I did share with the board a copy of the current dashboard, and the current dashboard is really a tale of two things. One is that all the items that are not in a positive direction are enrollment related. That's a national phenomenon. That's not unique to ETSU. If you look, there are some successes though in the enrollment area. The quality of students that we're obtaining or that we're getting is better. Transfers are up, and graduate enrollment and out of state is trending in the right direction. You're going to see, I think, a local first approach to enrollment, and there's some early indicators that'll be in some data the president will share that that's working. And then some of the initiatives that you've been involved in relative to tuition pricing and other things should attract a larger pool of students. The other thing that's in here, though, is success. And it's a dashboard that represents a really healthy institution. We've seen great strides in externally sponsored research. That doesn't include the service. When we do include the service, we're at 53 million, which is well on our way to our goal of 60 million. You can also see a robust submission of funding proposals, and that increase is going to yield a higher level of funding throughout the institution. I want to highlight one thing that Pam Ritter did in the Finance Committee earlier. We're going gangbusters on dollars raised. We're having trouble hitting the mark on % of alumni giving. But at the end of the day, if you ask me which one I'd rather have a dollar in the bank than a head count. And they're killing it. I mean, they are really showing that the story that ETSU has to tell is being told. And we're seeing the response to that happen through financial contributions. And so that's really important to acknowledge. The other thing is student success. The retention rate's the highest it's ever been in the institution. And if you look at the current trajectory that we're on, we could have hit the 85% retention rate by 2026. The graduation rate, although favorable, works against us in our enrollment goals. I mean, we're graduating so many more students than we ever did that it's hard to refill those seats. We're seeing success across the board in graduation. Graduation rate, male, female, and in the non-white population are all improving. None of those are where we want them to be. I'm not saying that we're going to stop trying to improve student success, but I do want to highlight to you that this is the highest point of student success in this institution's history. It's represented in the funding formula and the outcomes. It's represented on this dashboard. And I think that Dr. Sherlin and his group have a strategy in place that's going to start to share that more. And the more that gets out, the more people are going to want to participate. And we're doing it at a lower cost than we've ever done it for many people. And that's important too, because affordability, I think, is going to be the way that we make our mark in higher education, particularly for regional institutions that care about the population in their area. There are other areas where we need to see improvement. We do need to see more males going to school. Although in the dashboard, it looks like the faculty went up, and Dr. BJ King mentioned in her presentation this morning that we saw a reduction in staff totals. That's true in this current year. The dashboard looks at the fall 2020, and so we haven't realized all those reductions yet. And so you'll see that represented in future dashboards if we can keep that position control in place. I say that a little bit tongue in cheek, but that's what we need in order to make everything work out. Overall, the dashboard of the institution is in a better place than it was when we started, and we set some aggressive goals. But it's encouraging to see all the work that the faculty and staff and students of the institution have done and the support you've provided start to pay off in a big way. And I think the more that we can tout this, the more people are going to want to get involved at ETSU. And I'll stop there and see if there are questions about the dashboard. Go ahead, Dr. Foley.
I have a question about the faculty profile.
Mm-hmm.
I'm curious to know if we have changed in the percentage of tenure track faculty and instructor lecturer positions. I don't expect you to answer that now, but anecdotally, at least in the Clemmer College, a lot of departments seem to be asking for instructors, whereas in the past we would have asked for tenure track faculty positions. So I just want to know where we stand on that.
I'll get a report to the board. I'll share with you. Staffing is in flux partly because the educational demand when enrollment drops this much is lower and the distribution of students across programs is different, but I'll get you a profile by department and college.
Thank you.
Anyone else? Thank you, Dr. Hall.
Okay, now we'll move to the discussion of 125, which is the exciting part. I mean, the dashboard is one thing, and it talks about where we are now, and it shows that we've had success. We're halfway through the current strategic plan, and we're some distance from 125 Chapter 1. So it's time for us to make a revision. And in the documentation that I shared with you, there's a chart. Any continuous improvement process includes a closing the loop. And that's what this year is about. It's about reviewing what worked and what didn't, about celebrating what worked, providing changes, considering new initiatives that align with our budget, and implementing changes to continue what works and increase innovation. Overall, the purpose of this is to get future focused. COVID is an acute problem, but also institutions tend to get stuck in their ways. I think that everyone would agree that the discussion in the academic research committee this morning was one that showed a different way forward. And the more people around ETSU in the community and the other educational providers that we can get talking about other exciting opportunities, the better. There's some data that the president's going to share later about the pipeline. The state of Tennessee has done a good job of getting more ninth graders to graduate high school. Overall, the state of Tennessee has not done a great job of improving the percent of those students that go to college and the percent of those students that graduate. And that's what we're going to focus on. I mean, that's a big part of what we need to focus on. That requires us to increase our research productivity in breadth. It requires us to change our programming, which you saw in the academic committee today in some of the presentation that Dr. Samples made, and in some of the other activity around campus. We've also engaged some external consultants. In a process like this, you're never able to exclude your bias enough to get a real look at yourself. So some of you will be included in some interviews. and focus groups over the rest of this semester. And then next semester, we're going to engage heavily in a committee-based process of identifying, based on the data we collect this fall and the pipeline data that we create this fall, initiatives we can do and implement that will improve outcomes for the region. Dr. Nolan, I'm sure won't let his presentation go by without mentioning the reason we're all here, so I won't rehash it now. But at the end of the day, the outcome for this institution is to improve the lives of the people of this region. And there are many ways that we can do that, and there are many ways that we are doing it. But one thing that I think is really important to note is that there's a lot of excitement about this, not just from people at ETSU and people in the community, but I've heard in several presentations across this campus in the last month that ETSU needs to be the convener. We're the group that has the most neutral ground. We're the least likely to create an argument. We're the best place for people to discuss openly ideas of change and to dream about the future that we all want. And that's what I hope comes out of this process. And today I just wanted to give you a little bit of a precursor for what you can expect. And I appreciate all your participation in this process.
Are there any questions for Dr. Hoff about the KPIs and or the 125 process?
If I could, just real quick, just a personal point. We talked a lot about student success. If all goes to plan, in about 30 minutes, my wife will successfully defend her master's thesis and become a graduate of East Tennessee State University for the second time.
Congratulations.
Congratulations.
That's awesome.
Yes, that's great.
Next item on the agenda is ETSU COVID-19 Medical Response Team update. I'd like to ask Dr. Bill Block to report, please.
Thank you, Chairman Niswonger and board members. Hopefully I can share my screen here with some success. There we go. Thank you for the opportunity to talk with you this afternoon. I would like to take the time to kind of review where we've been over the past few months and what changes we have made across the university and across ETSU Health. And then just a few slides on where we stand with the current pandemic and the effects it's having on both the nation and the region. Beautiful fall picture back when all of this started, or shortly into the beginning of it. Late February, early March, so just over 8 months ago, we started meeting under the guidance of Jeremy Ross to have a task force to look at what we'd heard was a coming virus. The first meeting I attended was March 4th, and we were notified March 5th of the first case of COVID-19 within the state of Tennessee. Less than a week later, the university made the decision that we would go virtual after spring break, and that would be for a shortened period of time, for the initial plan being 2 weeks of virtual environment, with the hope that we would be able to resume classes after that time. The next day, Governor Lee took the state of Tennessee into a state of emergency, and the NCAA canceled the basketball tournament, which many of us were looking forward to and felt we had a good chance of having some success. By March 20th, Nashville had surpassed 100 cases of COVID-19, so 15 days after the first case was reported, and we had the first death in the state of Tennessee. Also on March 20th, we had reports that 5 students from Tusculum University had returned to Greenville positive for COVID-19 from spring break, and they had all been traveling together, returned, and were kind of the first cluster in the region. We also knew at that point that our students, had we not made the decision to go virtual, were scheduled to return 5 days later. Thankfully, we had made the decision that they would not do that in an effort to flatten the curve, as we were referring to it at that point, and to really try to keep a lid on the number of cases that were occurring. By March 27th, Tennessee had had 1,000 cases of COVID-19 reported, so in 22 short days. We worked through the rest of the spring and into the summer in an effort really to decrease density on campus. We converted all of the classes to virtual. The faculty and staff all deserve a huge amount of credit for the effort they made to be able to continue the learning environment, both with a virtual environment for the students and converting their work to remote and essentially trying to stay away from our campus and our buildings. We instituted a mask requirement amongst the campus, and we educated people onto why masks were important and how we felt those could help stop the spread of the disease. We organized and executed a virtual commencement event, which we had not done before, and lots of people put a lot of effort into, and really went very well across the entire university. It was an enjoyable event for the College of Medicine. During that period of time, we spent a great deal of effort shopping, acquiring PPE for both our clinical settings and our learning environments. The supply chains were not equipped to deal with the shock that they had with the onset of the pandemic, as many of us know from watching events that unfolded in New York and really across the country. Also in March, ETSU Health stood up the first mobile COVID testing site in the region on March 17th. Dr. Jonathan Mormon, who's our head of infectious disease, was named to the governor's task force on COVID-19 and continues to serve in that capacity. ETSU clinics implemented telemedicine visits, which was a huge change from how we did business and how we saw patients, but was pulled off very well with the help of a lot of faculty and led by Dr. Tim Canavan. Student clerkships were suspended mid-March at the recommendation of the AAMC. We instituted virtual learning environments for those clerkships, delivering content online until we were able to reintroduce students in early July. This is a picture of our mobile testing site set up outside of the clinical education building on North State of Franklin and across from the hospital. A lot of work by Dr. Sherry Holmes, Dr. Jonathan Mormon, Rusty Lewis, Beth Ann Henley, all went into making this successful and really offering the opportunity to have screening for the community before it was available with the health department and our healthcare partners. By early July, it was clear the virus wasn't going away and that we needed to really have a collaborative approach to managing this. We have many sources of expertise across the university. So we formalized that collaboration by creating the medical response team. Myself, Dr. Randy Wyckoff from Public Health, Dr. Roz Robinson, who's the Chief Nursing Officer for ETSU Health and Associate Dean in the College of Nursing, Dr. Sherry Holmes, who's our Chief Medical Officer for ETSU Health, Dr. Beth Fox, who's my Chief of Staff and Associate Dean in the College of Medicine, and Dr. Linville, who's our Executive Vice Provost. We met on a few occasions in July, a couple times a week, realized we needed a point person to help lead this effort and drafted Dr. Lee Johnson, who's an Associate Professor in the Department of Family Medicine and is also a Master's in Public Health, to really lead our COVID response for the university and for the medical response team. By late summer, as we made plans for return of the students, there were often meetings and instruction in how we were going to deliver content. Our clinical training had come back online in early to mid-July, but we knew students needed to come back to campus. We had return of athletics and initiation of testing protocols to try to maintain safety for the athletes and the staff. And we had ongoing planning for return of students, including the move to single occupancy, arrangements for isolation and quarantine requirements that Dr. Sherlin and his staff carried off so well, arranging for things such as food service. If a student is locked in their dorm room, how do they get food? How do they continue to isolate and remain away from their fellow students for simple things such as eating and doing their laundry? And also looking at things like health and well-being across all of the different domains. It's very difficult to be in isolation in your room for 10 days and coming up with some plan to still isolate and be able to get out onto campus, exercise, be by yourself, but be in nature was important. We continue to emphasize measures to prevent transmission. So you'll find mask signs requiring masks on campus if you have to be here for any reason. We emphasize distancing and good hand hygiene. We have hand sanitizer in many locations across the campuses. We also have instituted a great amount of testing. We have athletic testing for the NCAA protocols. We have medical student testing for classes where we're not able to maintain social distance. So our anatomy lab, we have 2 to 4 people around our donor cadavers, and they're not able to maintain full distance. So while we dressed the students in masks and face shields and full PPE, we also wanted to make sure that we were able to determine if students were coming into the lab with virus. So we test about every 10 to 14 days with swabs to make sure they're not COVID positive. We've also initiated a random testing protocol for students and faculty on main campus. It's a voluntary program, but it's been successful in helping to determine the level of viral spread on campus and hopefully decrease that spread. Of late, as Chairman Niswanger mentioned, we have established a COVID PCR testing site at the back of our community health center behind Woodridge Hospital. It allows people to schedule online, to access our testing, and to have results within 24 hours. And so we're currently seeing over 100 patients a day utilize this service and seeing really the testing results that we would expect in the community, often as high as 15% positive rates. As we continue to plan and work through what remains of this semester and going into the spring, we're also preparing for vaccine distribution. The promising trials that have come out with the Pfizer vaccine don't mention that oftentimes that it has to be stored at 80 degrees below zero. That's a freezer that most of us don't have in our homes, and we don't have a lot of spare freezers to be able to do that. So we do have a freezer that should be delivered December 3rd to help store that product should it be approved and distributed. We're also working under the guidance of Dr. Lee Johnson to make sure that we have our protocols in place to distribute the vaccine in the order that the state has recommended and the CDC has recommended. We're continuing to increase our collaboration with the Ballot team. We participate in their emergency operation calls at least a couple times a week. We have ongoing discussions with them over how do we back up simple things like if our freezer were to go down or one of their freezers were to go down, how do we get vaccine from one to the other to make sure that that stays safe? How do we optimize testing for the region? And how do we continue to try to prevent spread of the virus? We have continued monitoring of changing guidelines and really ongoing community advocacy for prevention. One of the latest announcements that we've had come out is under a letter from myself and Dr. Sherlin to the students and faculty discussing holiday safety plans. A lot of the spread we're seeing currently are within family units and within smaller groups than it was initially. It's important that we make sure that our circles remain tight and that we make sure we continue safe practices to try to decrease the amount of spread that's occurring. As we get into the spring, we also have to look at things such as event size. We have athletics coming online with the start of the basketball season. And we want to make sure that we have safe events where we're not at risk of continuing to community spread. We have student life events that have to continue and have to be part of the student experience for university to be successful. And we have commencement, which Chairman Niswanger mentioned will be virtual in December. We continue to look at the instructional format. What's the safety of the faculty, staff, and students, and how do we continue to maintain that safety so that we don't spread to both our faculty, staff, and students, but also their families and the broader community. And we also have to maintain student progression to make sure everyone is successful so that we continue to serve the mission that we have. I appreciate also the ability to take the opportunity to touch base on where we really stand with the pandemic at this point. Through the 10th of November, on Tuesday, the state of Tennessee had approximately 290,000 cases of COVID-19. I would ask you to recall that March 5th, we had our first case. So a huge amount of spread of this disease. We've had 3,762 deaths in the state of Tennessee since March that are attributable to COVID. For reference, last year in 2019, we had just over 900 motor vehicle deaths in the state of Tennessee. So 4 times that number have died from COVID in just the last 8 months. In Washington County, in the past 7 days, we've had 484 cases. It's a daily rate per 100,000 population of 53.4 cases. When we first went virtual in our classes and in the K through 12 program, the talk was that we would come back for in-person learning if the numbers were less than 11 cases per 100,000. We're currently at 53.4. Our rate since the onset of the pandemic has been 14.2 cases per 100,000 per day. So we have not been below that rate on average since the initiation of the pandemic. We often heard that this was similar to influenza, and I'd like to take the opportunity to put that to rest. The last flu season, which lasted about the same period of time, we had 38 million cases in the US. So almost 4 times the number of cases that we've seen of COVID-19. But we had 22,000 deaths in the US, all of which are tragic, but a small fraction of the number that we've seen of the COVID-19 virus, which to date has had 10 million cases in the US and 240,000 deaths. Here's the current graph from the Johns Hopkins website as to our rate of daily infections. To the right, we can all see in October that we're headed the wrong direction. In the last 7 days, we've had over 920,000 cases of COVID-19 diagnosed in the US. Almost a full 10% of our cases have been diagnosed in the last week alone. This is a cumulative death graph for the state of Tennessee. Again, headed the wrong direction, but showing where we started at the end of March and where we stand today. It's really difficult to put those numbers into perspective. I received an email early this morning telling me about Dr. Joe Hall. Joe was a classmate of mine at Quillen. We graduated together. He pursued family medicine and established a practice in his hometown in Waynesboro, Tennessee. He died last night from COVID-19. These are not numbers. These are people. And anything we could do to stop it, we need to do. I appreciate the opportunity to talk with you all today. I think there's a lot of tragedy in what I had to say. There's also a lot of promise. We've learned much better to work together as a medical community. We've learned much better to work together as a university and as a collaborative effort to keep our students and faculty safe. I wish we were able to keep our community safer. We continue to try to work on that education and to be able to do that in guidance with our leaders who've been very helpful, and we've tried to provide as much support as possible. I'm happy to take any questions, and I appreciate all of your all's support.
Any questions from the trustees? Dr. Block, what is the, you may have said this and I missed it, the death rate?
The current, so if we just, I'm attempting to try to stop my screen share if I can figure out how to do that. The current death rate just from our pandemic at 240,000 per the 10 million that we've had really equates to 2.5%. The interesting thing is that We have gotten better at treating this. We know better how to keep people out of the intensive care units. We know better. We have some help with dexamethasone and remdesivir, but they're not cures. So we don't really have a cure yet, but we do have the ability to improve the outcomes. I am very concerned that we're hearing reports that hospitals are full. If we look at a country like Italy, where they've had closer to 5% mortality, a lot of that was due to overwhelming the healthcare system. If we have no ICU beds, or we have no hospital beds for people to go to, our numbers are unfortunately going to get worse. So very important that we do everything we can to stop the spread.
Other questions? Thank you, Dr. Block. You and your folks stay safe.
Appreciate it.
Now, our long-awaited President's Report from Dr. Nolan.
Mr. Chair, members of the board, thank you for the opportunity to walk through a number of matters with you today. But before beginning an attempt to do a screen share, I just want to take a moment to thank the board for the support that you've provided to staff since March, as we've wrestled with some very difficult decisions around how to combat what has been something that no one was prepared for in graduate school. The leadership that Dr. Block and his team have provided is exemplary. The work that Lee Johnson has done is exemplary. Bill Rasnick, Jeremy Ross, all the staff in facilities, their work has just been outstanding. I'm extremely hopeful that as we move into early 21, that we'll have vaccine, that Dr. Block's refrigerator will arrive and will allow us to do the things that Lee Johnson is preparing to do with distribution. But this has been an atypical year. But what has not been atypical is the leadership of this institution. And before beginning a share screen, I just wanted to thank the board for allowing our staff to do the things that they do. So let me see if I can share screen. And okay, do we have a screen up that says East Tennessee State University President's Report to the Board of Trustees?
Yes, you do.
Fantastic. Well, Mr. Chair, members of the board, would like to touch upon a number of issues in my formal update. I want to provide an overview of enrollment. I want to talk a little bit about the budget forecast for the upcoming year. We'll discuss some emerging issues across the institution, and then we'll kind of close with some reflections on the year of 2020. But want to first provide an enrollment update, not only for the campus, but for higher education in the state of Tennessee as a whole. As we look across the institutions that comprise the state's higher education system, I draw your attention first to the universities. As you can see across the universities, here East Tennessee State University shaded in gold. Our overall undergraduate enrollment is down right at 3.3%. Graduate enrollment is relatively flat. Across what would be the Board of Regents institutions, you see a little bit of variability, but most have experienced some level of enrollment decline. TSU undergraduate enrollment down 5.7%, their graduate enrollment down 26%. Looking at the UT system, Knoxville is the one institution in the state with pronounced enrollment growth, 5.5 percentage point at the undergraduate level, 3.5 percentage points at the graduate level. But overall enrollment in the universities relatively flat. If it were not for graduate enrollment, you would see a decline. The community college picture is very different. 10% statewide decline in enrollment in the community college sector. At our sister institution, Northeast State, an 11.3% decline. Southwest Tennessee Community College out in Memphis down 22%. And these numbers are important because as an institution whose enrollment strategy in some respects is heavily dependent upon transfers, if there are fewer students moving through the pipeline, then 2 years from now, we will project to see fewer students transferring to ETSU. So we pay very close attention to what's happening in the community college setting because of its downstream impacts on the university. But let's drop in and look a little bit about undergraduate enrollment statewide. And this chart for me is really interesting. So if you look at the red, that's community college enrollment. 2010, 88,683 students enrolled at the undergraduate level at the community colleges. At the end of the decade, 25,000 fewer students enrolled in the community college system. That's after the investments of Tennessee Promise and Reconnect. So you're really seeing some systemic changes that are moving through here. Some of it's due to the rebound in the economy. The drop here is obviously due to COVID. The gold line is the Board of Regents University system, down about 10,000 students. The only sector that's up is the University of Tennessee systems at the undergraduate level. Now let's drill down on that undergraduate level some. Here's distribution by gender. This is for current year. Dr. Hoff mentioned in his comments declining participation rates for men. Look at these declining participation rates for men in the community college sector. That's a 15% decline year over year. So as we look through the middle of this decade and towards the end of this decade, you're seeing potentially an entire generation of young men who may miss out on the knowledge economy by their decision to forego participation in post-secondary education. And I'm hopeful that can change post-COVID, but that's some of the changes that are occurring by gender. Now let's look by race. In fact, if it were not for the growth of Hispanic students across the state, there really isn't another demographic sector that's growing other than Caucasians at UT. So across the board, decreases at the undergraduate level by race. The age numbers here tell a similar story. You see those significant drops in the community colleges, once again for males. 17% fewer males aged 25 to 64 enrolled in the community colleges this year over last. 16.8% fewer students in that typical right out of high school demographic. Now let's cut it a different way by student level. Here you see that where we have held constant at the undergraduate levels, juniors and seniors, that makes sense. Those students have deeper roots. Freshmen and sophomores' roots are shallow, and they've been impacted by COVID, many just sitting this year out. Now let's look at it through one last slice, income. But this is income on the front end, pre-enrollment. So for those of us who watch these numbers, we were projecting a disproportionate impact of COVID on low-income students because in the spring, we were seeing these FAFSA completion numbers start to move through. 14,000 fewer FAFSAs completed for Tennesseans whose income falls below $36,000. So we had projected that you would see a lot of low-income students being negatively impacted by COVID. And when you look at enrollment, that is in fact the case. 3.5% fewer students in the lower income threshold enrolled this fall than in years past. So as you look at COVID statewide, fewer males enrolling, fewer students overall enrolling, fewer Caucasian students enrolling, and fewer low-income students enrolling. So what's the picture look like at East Tennessee State University? I've shared this information with you before. It was included in my State of the University address, but I'm sharing it again. We're right at 14,000 students total enrollment, overall down 474 year over year, which is right within where our revised enrollment projections were this summer. Significant enrollment, however, in programs like nursing and psychology and biology, computer science and management. Those are some of the programs that saw large enrollment numbers this fall. The demographic composition of our students looks a little bit different than those trends you saw at the state level. Our African enrollment numbers are up. Our Hispanic numbers are up. Caucasian students are down. Our male numbers are down, but not to the extent that they were across the state. But still, when you look at the percentage, 62% undergraduate population female, 37.9 male. Just a few short years ago, it was 42 and 57. So that demographic change you see occurring here by gender, but we've not seen the demographic changes by race. In fact, the university is more diverse this fall than it has been in a long time. In terms of where our students come from, the predominance are still Tennesseans, 80% Tennesseans. In fact, we're more heavily dependent upon Tennesseans now than we've been at any time. Why? Because of the significant decrease in international students. If you were to go back and look at our strategic plan from 2016, our goal was 1,000 students. We're at 288 this fall. Those numbers probably will not rebound to 678 until the end of this decade. It will take at least 7 years for those numbers to come back. So if you look at our overall enrollment decline, we lost students in the border counties, we lost international students. That drove a lot of the decline at a macro level across the university. But when you drill down and look at by grade level, you see the smaller freshman class. Experts had predicted that between 15 and 20% of high school seniors would take a gap year. And you're seeing a lot of students take that gap year as our freshman class is more than 400 students lower than where we would like for it to have been. However, we did not see a drop in quality. The average GPA is a 3.5. The average ACT score is a 23.4. And our high achieving students, the numbers are down a little bit, but still all in all, the academic composition of the class is right where we want it to be. I wanted to share this information with you because I know many of you support high schools around our region. You support scholarships for students from some of these high schools. And I think this is also helpful because it gives a sense, as Dr. Hoff noted earlier, about the region-specific approach we're taking on recruitment. But I don't see any major shifts here in enrollment by high school. You know, Science Hill's actually up a little bit over where it was in 16. So is Dobbins Bennett. Boone's down a little bit. Elizabethton High School's relatively flat. But there's not a lot of major swings here in the schools that have been our prime partners. As I referenced earlier, the major swings were out of state and international. Our goal is to drive these numbers, and we're going to drive them up to get to the levels we want to attend. But I wanted to give you some visibility, you know, for members of the board who support students coming out of Unicoi County High School, or for members of the board who have an interest in Greenville High School, or for members of the board who have parents who have children who attend Science Hill or Dobbins Bennett. There's not anything atypical here in these numbers, which for me is good news. The recruiting efforts that we put in place held even though we had a pandemic. Want to also share with you transfer numbers. Our transfer numbers for Northeast State have increased year after year. This number for me is interesting. Look at where Knoxville is placed. We receive more students who transfer to ETSU from Knoxville than we do Chattanooga State, Motlow State, Mountain Empire, Cleveland State, Ball State, Columbia State. So these are students who head to Knoxville and then realize that a family feel small college environment here may be a better fit. And you can look at also transfers from Milligan and Tusculum. So just wanted to give you a sense of where our transfer students are coming from. But I will draw your attention here mid-slide to some of the recruitment efforts that we've put in place to attract more transfers from Ball State, Columbia State, some of those middle Tennessee community colleges to bring them over to Northeast Tennessee. Dr. Hoff mentioned our retention rate. I shared this with you before, but it's the highest in the history of the university, 78%. When you look at our retention rate in comparison to the other schools, this is for last year. I don't have the new data yet, but that's 78% start at ETSU, return at ETSU. That's higher than last year, start at ETSU, return anywhere. That's a major increase. Our start at ETSU, return at ETSU is higher than the anywhere number from last year. But there's also a fair amount of other student success that we've experienced this year. Dr. Hoff mentioned the degrees conferred, the average GPA for the class, our 15-to-1 student-faculty ratio, our almost 500 students in dual enrollment courses, a 57% increase over the prior year, and then 4,700 students named to the dean's list. Our graduation rate tied that of last year, and last year was the highest in the history of the university. And when you look at start at ETSU, graduate from any public university in the state, that adds another 7 percentage points to that number. So our overall grad rate, I anticipate this year, will be right at 58%, highest in the history of the university. And then when you break that down by demographic group, you see the real increases here in the success rates for African-American students and the success rates for Pell students holding their own. But Dr. Hoff mentioned the pipeline. And the pipeline is a different way of looking at these data because they take our data and put it in conjunction with our partners. And for me, this is the real series of numbers that we need to look at as it relates to educational attainment. Of every 100 ninth graders who start high school in the state of Tennessee, how many graduate from high school on time? 90. How many go on to college the following fall? 62. And how many graduate from college within the prescribed federal time frame of 150%? 27. So as we embark upon 125 Chapter 2, you're going to hear me talk a lot about this sequence of numbers because this sequence of numbers ties into ECD, it ties into research growth, it ties into a lot of the things that impact the quality of life for our region, which is the mission of this institution to improve the quality of life for the people of our region. So, Mr. Chair, but before shifting gears and jumping into budgets, let me pause to see if you or any members of the board have questions on the enrollment and student success information that I've just walked through in the past 14 minutes. Okay, seeing none, then I will shift and move to budgets. Just a quick glimpse of the budget landscape. We're familiar with the fact that our funding is provided by an outcomes formula, that capital funding and support is intertwined within the goals of Drive to 55. And we are all focused on how those outcomes drive the investments that the state makes. As a reminder, here's the process through which funds are distributed. The bulk 95% through the outcomes formula, the other 5.45% through a student learning quality initiative program. The old performance funding is the other residual. Here's the frame upon which those funds are distributed. Students moving through the pipeline, degrees produced, research dollars, graduation rate. Here's the history of funding in the state of Tennessee since 16. You see the significant increases marched from 16 to 21. A lot of that through these years are salary enhancements. So the 55 to 70 is investments in salary and operating. You notice this past year, everything's essentially held flat. I cannot thank Governor Lee and members of the General Assembly enough for holding higher education harmless from the budget reductions. State government as a whole took a 12% reduction, higher ed did not. And you see that referenced here in those numbers. The increase at ETSU reflects our increase in the outcomes formula. We were the top performing institution in the outcomes formula last year. And then here's similar data for the non-formula units. You see the funding there for the College of Medicine and our family practice units, the inflationary based elements that comprise the funding there for those non-formula units. Here's the THEC recommendation for next year. On Tuesday, I was with Mike Krause, Randy Boyd, and Chancellor Forth Tidings before Governor Lee in the higher education budget hearing, making our request for new funds. You see that ETSU was the #2 performing institution in the state this year on the outcomes formula. That's the $505,000 in new dollars on outcomes, and then the $2.2 million, the other portion of outcomes. So if the formula is fully funded, $2.7 million in new operating revenues for the university. That is the request that was presented to Governor Lee on Tuesday. And that's the request that will then begin budget conversations moving in to the upcoming legislative session. From a capital perspective, here's the new capital list. That academic building, the Academic and Humanities building, is the #5 project on the list. Last year was #8, so we moved up. The Tech and Austin P numbers were held, buildings were held in place. Those were in Governor Lee's budget, but they were not able to be funded because of COVID. I'm hopeful this year that we may be able to fund the bulk of this list, but really want to thank Jeremy Ross, former Dean Gordon Anderson, for their work in getting this material in front of THEC, and we're locked in solid at 5, which is a good spot to find ourselves in. And then here's our deferred maintenance list, and I gave you the deferred maintenance list on the out years because there is some conversation about potentially bonding deferred maintenance and capturing the totality of this list for all of higher ed. So let me shift and move on to some legislative and campus initiatives for this year. In terms of our legislative initiatives going into the 21 cycle, we fully support the outcomes formula of THEC. We support their request for enhanced operating dollars for Quillen. We support their request that they put before the governor for the academic and humanities building, support for deferred maintenance. I would like to draw your attention to the moment around Gatton. There are some conversations in the state about the state acquiring a private institution and bringing it up under a public umbrella. I'm hopeful that if the state does acquire a private institution, that they would look at funding the private College of Pharmacy here at East Tennessee State University. And then lastly, given COVID, I think we've seen the necessity for a little bit of operational flexibility to allow us to respond at the speed of business. So this is what we are carrying forward as the legislative agenda for the upcoming session. Mr. Chair, there's been a lot of talk about COVID over the course of 2020. And I want to assure you and the members of the board that as staff, we have directed a great deal of our attention to things that we can do to support our faculty, staff, and students at the university. And I want to share with you some of the things that we have put in place, directed efforts from your leadership team to support the faculty, staff, and students. These are some things I wish were not on the list, particularly the first bullet, but they are things that are on the list nonetheless. We have launched the search for a new chief academic officer at the university. Dr. Keith Johnson will chair that search. We've hired a national search firm, Parker Executive Search, who will help us get that moving. We also have searches underway for Dean of the College of Nursing and the Clemmer College of Education. I anticipate that the Clemmer search will wrap up by the close of this month, and we hope to wrap up the provost search by the spring semester so that the new provost can be in place for the start of the fall. Dr. Bishop has led a series of efforts to ensure that there are proper operational and staff support within the office of the provost, bringing into the fold new staff such as Amy Johnson and Bill Flora, who are helping to support initiatives for our faculty across the university, both as they bring new courses online, as well as we try to start new programs across the institution. Dr. Sherlin is leading a lot of work to restructure the way we recruit students in a COVID environment. When you can't get into high schools, when there are no recruiting fairs, you've really got to be creative. And we're working hard in those areas. We've brought in some outside support to help us look at the nature, function, structure of our marketing efforts, both internally as well as externally, and look forward to sharing with the board and the campus over the course of the spring semester some work we're really doing to amplify our ability to tell the story of our faculty and our students to communities and do a better job of marketing the university. At the last board meeting, you approved changes to our out-of-state tuition model that will allow us to attract more students from North Carolina and South Carolina to the institution. And Dr. Sherlin is leading efforts to restructure and strengthen our advising programs to coordinate scholarships and financial aid in a tighter way than they have ever been. All of these bullets are things that have been underway during COVID. We've hired a new chief of police. We've significantly enhanced the scope and safety of aspects across campus, particularly technology. Today, we talked about the work that Bill Duncan and Professor David Golden are going to lead around reviewing the nature, purpose, and structure of the research foundation, potentially transition to a corporation, to build out Valley Brook and to really realize the dreams of our faculty and the board in this space. We've got a lot of work that's happening with Ballot. And I think as we move into 21, you'll see under the leadership of Dr. Block, a real tightening and potential integration of operations with Ballot in a way that is very similar to what you see at major partnerships between academic health sciences centers and the hospital systems. We're making progress towards capital projects. Pam Ritter, in her comment to the board earlier, talked about the construction outside her office. By spring semester, that green space will be complete all the way down to Ross Hall. The Martin Center is open. Many members of the board were with us earlier this semester as we had a soft opening, and we look forward to the full opening in 2021. And we're getting the staffing function there organized. We'll relaunch ETSU Elevates in the spring. And just to remind everyone again, as Ms. Ritter mentioned, we've got an active capital campaign underway. We're approaching $90 million, but we've got more work to do. And also under the leadership of our foundation, General Ron Haidt, we're looking at how we can diversify our portfolio of investments, potentially investing in some real estate that would allow some opportunities for revenue enhancement and stability in what is an increasingly unstable environment from a market perspective. Dr. Hoff talked about the Committee for 125 Chapter 2. A lot of data collection, a lot of focus groups, a lot of inquiry and discovery that's occurring this fall. Also, as we move through December and into January, there'll be a fair amount of purposeful public celebration of the accomplishments that the university realized over the last decade. We're going to get all this material together from a data perspective, a focus group perspective. Many members of the board are going to be involved in this feedback process to then position us as we move into 21 to bring to bear to the board the work of some outside entities. The real committee for 125 Chapter 2 is the board, but to support the board, we're going to bring some national thought leaders in economic spaces, research spaces, and in higher spaces to help inform and to structure our dialogue. You'll see websites and everything get up and moving. We'll have the broad campus dialogue throughout 21. And then the goal is for fall of 21 to have a final document, a final vision statement, as Dr. Latimer mentioned today in the Academic Affairs Committee, really to dream big. We had a big dream conversation around research, but I look forward to the other big dream what if conversations across the spectrum of the university as we get past COVID. So as I kind of close and look back at 20, as we look back at 20, much of 20 is going to be a year in which we remember COVID. But Mr. Chair, I'd like to conclude my comments not on COVID, but on people. Because as we bring 2020 to a close, for me, the takeaway from this year is the impact that people have had on our university. We've put in place a voluntary retirement program, and between that voluntary retirement program as well as normal retirements, this is a year in which legends across this university are bringing their careers at ETSU to a close. People such as Gordon Anderson, former Dean of the College of Arts and Sciences, Dr. Bert Bach, our former provost, Gary Bishop, who led instrumental work in the fiscal plant, individuals such as Maria Costa, who worked with international students for decades, who I had the great privilege to go to China with a number of years ago. Mary Craddock in the president's office, who's provided invaluable assistance to me, and as I joke, has kept me out of jail for the better part of the past decade. Tim Deals, an advisor in the College of Business, who every single year sends birthday cards to every person he advised and sends birthday cards to people who he has had the opportunity to build connections with. People like Ann Ergel, who worked in the president's office, who works in the provost office now, who makes some of the best holiday treats with Chex Mix you've ever had in your life. Individuals like Kathy Fegans, who've worked in the scholarship office and assisted thousands of students receiving financial aid to enroll at the university. Individuals like Tom Hill, who've worked with Bucky's Food Pantry. And if you know Tom, anytime you're around him, you smile and you feel good when you leave. individuals like Jackie King in our library administration, folks like Diana McClay in HR, who've helped us work through difficult HR issues and who've helped counsel individuals providing HR services for a long time. Peggy McCreary in University Advancement Offices. Individuals like Lieutenant Orr, who last year was the Outstanding Staff Member of the Year, have retired from his career at public service. Dr. Richard Osborne, Dean of the College of Continuing Studies. Joanne Patey, who worked in athletics. Bill Rasnick, who led our facilities efforts for decades and led a lot of the COVID efforts that kept this campus safe over the past year. Our bursar, Jane Waddell, and Mr. Chair, I could go on and on and on. Sir, these are not names. These are people who gave their heart and soul to this university. So as I reflect upon 20, I'm not going to remember COVID. Well, I will. Who could forget COVID? But I do not want you to forget these people who made a difference in the lives of the people of this institution. Because, sir, when it's all said and done, that's why we're here. We're here to serve. We're here to make a difference. And I want to thank those members of the university community who have retired from the university this year. Sir, this is our last board meeting of the year, and I did not want the year to close without thanking these staff one last time. Mr. Chair, that concludes my report, and I'd be happy to address any questions, and let me stop the share screen and get it back so we can see some faces. But thank you, Mr. Chair. Be happy to address any questions about these or other items.
Well, I have a comment for you, Dr. Nolan. Of all the important data that we just looked through, I want to congratulate the entire ETSU family on the outcomes assessment. At the end of the day, you can have a great experience, but the outcome and being prepared to take on that job once you graduate is of the utmost importance. And in this year, certainly safety ranks first. Congratulations, Dr. Nolan, to you and the entire team.
Sure, thank you.
Others?
I ditto Scott. He said it best. Dr. Nolan, during all of this, ETSU could have said, you know, we're not going to get any more students, but you stood up and your entire staff, y'all stood the course for and were prepared, or better prepared for COVID-19. So again, congratulations.
Well, Trustee Grissom, I thank you, and our story, we don't do a good enough job of telling it sometimes.
Right.
You know, I don't mean to minimize the impact of students who had spent weeks in quarantine, but on our worst day, we had 50 students in quarantine. There are other institutions in the state that had 2,000 students in quarantine.
Right.
So if you would have told me at the beginning of the semester that we would have closed without disruption, I don't know if I would have believed you, but we're there because of the work of Bill Blockley Johnson and some of the names I read, Bill Rasnick. But it's been a year for the books. I'm ready to put this year to bed.
I think we all are.
I bet.
That's right.
Others?
I have a question.
Dr. Foley.
My question's about the search for the provost and the dean of the College of Nursing. Will you be bringing candidates to campus, or will those be conducted virtually like the college, the Clemmer search?
Dr. Foley, I can share with you intent, but as I look at these faces on a Zoom screen, I'm reminded of the intent that I shared with you at the last board meeting, where it was our intent to meet in person. We intend, and it's part of the search process, to bring final candidates to campus. Hopefully by March, April, we're in a different posture as it relates to COVID. But within the protocols for both of those searches, it is our intent to bring the final candidates to campus. In what would be airport interviews will be Zoom. But in my meetings yesterday with the search firm Parker for the provost, we were talking about bringing 3 or so candidates to campus for that position. And I'm assuming we'll do the same for the Dean of the College of Nursing.
Okay. Is there any other business to come before the Board of Trustees today? Next would normally be our consideration of executive session. I see no need today for the board to convene in executive session. At this point, I'd like to ask, thank you all for a great meeting today.
Yes.
Very
yes.
informative, very well prepared, very impressive meeting. Thanks for everyone for what you're doing during this particular period of time. I'd like to ask Lieutenant Governor Ramsey for motion for adjournment.
I move we adjourn.
Do I have a second?
Second.
There be anybody against this adjournment? Thank you all. You all continue to be safe. Godspeed.
Thank you, Scott. Good to
Thank
see
you.
everybody. Y'all stay healthy and safe. Bye-bye.